Greeting everyone. I am Dr. Deependra from Conceptual Orthopedic, and I welcome you all in today's connection with Vivek sir. And today sir is going to discuss extracorporeal radiotherapy for bone sarcoma. So I think this talk is going to be very useful to all of you. So without any more delay, I welcome you sir on the booth, and I request you to start your presentation now. It's over to you, Dr. Vivek sir.
Thank you, everyone. So, I think as new people are joining and we need to keep revising things, this is a very important topic about extracorporeal radiotherapy. This is apart from exam question. This is a very good topic where practically you can solve a lot of cases in orthopedic oncology, especially some situations where we don't know patient is not affordable. You need to do some biological reconstructions, all those things. So for you, I can see from our old classmates, Neha is there. Other names I think are new: Satyaki Ghosh, Abhishek, Masi Sabri. Where are you from, Masi? Abhipray. You can write in the chat box also if you cannot unmute yourselves. Okay, fine. So now few things will be revision. And today, the case which I have kept today for ECRT is the case which I did just, I think, 2 weeks back around. So this is something very interesting because it was in my mind to show you guys what exactly is extracorporeal radiotherapy. Because, initially, uh, this is a common topic. This is a common question that is asked in the exams and in DNB exams in your MS. And this is something new. Though people say new, but I think I've been seeing this for at least for 15 years or so. And a lot of new advances have come. We have uh, we have devised our own ways, innovative ways to carry on these type of surgeries. So let's go today. Let us first go through the basics. Let's not just directly jump to ECRT. Let's go through the basics. So here what you see, okay, let me ask. Satyaki, can you read this X-ray? What's there on your screen? You can unmute yourself and speak. What do you see here? Or anyone? It's okay. I think anyone. What do you see in this X-ray? A quick recapitulation of what we always discuss. Reading of X-ray. I think it is basic. Okay, Neha, you want to take a trial? Neha is there or she left? Anyone? Come on. Where else you'll get this opportunity of in your comfort zone to discuss all these things? What do you see here? Tell me.
Sir, this is a X-ray of a uh, low, X-ray showing a tibia and fibula.
Right.
Right side lateral view. It is a skeletally immature and
Skeletally mature, immature.
sir, immature, sir.
Why do you say immature?
Sorry, sir. It's a mature one, sir. Because the five. So the proximal part is like the physeal line. I'm not able to distinguish between the cystic lesion and the one which is going on. But
No, no. Very good. So effort has been made. You know what to see.
yeah.
What you're finding may be, it may be ambiguous. We may have some differences. That is another thing. But what examiner really wants to know that how is your approach. So I'm very happy that you have correctly pointed out number one about the maturity. You are justified in what you're saying. That's fine. Okay. So according to you,
Uh,
X-ray of
and then so there's a wide the zone of transition. Probably it's so I'm not able to comment upon it's a sclerotic or lytic. I feel it's like a mixed. kind of lesion,
It is a mixed type of lesion, yes.
and involving the proximal third. Uh, uh, as of the matrix part, sir, I'm not able to appreciate any ossification or calcification. Uh,
So why are you saying then it is a mixed type of
so
uh, lighting? When you are saying it is not
it's
purely
a
lactic, it is mixed. That means there is some matrix.
yes, sir. There's a matrix which I'm not able to appreciate. Like which one is it? Like
So you can say calcified,
okay,
ossified.
okay, sir.
दो ही तरीके के होते हैं, chondroid,
Yes,
ossified or calcified. So you
yes,
can
sir.
say anything.
And so there seems to be a some soft tissue swelling, but not like
Okay.
very very significant. And um, so looking to the lower margins, the periosteal reaction is like I can't see the side. I am not able to appreciate the periosteal reaction, sir.
Okay. Fine. So you are in which year, Abhipray?
So I've completed my MS, sir, and now I'm in US. Finished my step one, doing a research fellowship in pediatric orthopedics.
In
So
US.
yes, sir, at
Good.
Boston Children's Hospital.
Great. Great. My current fellow who is joining from this week, next week, is also MRCS and he has completed 8 years post his MS. So he is also interested. Okay, good, good. So that's one thing is good that you are still connected to Conceptual because it was not just for passing exams, but you feel that it adds quality to your knowledge
Yes, sir.
and to your information about many subjects.
Yes, sir.
So fine. So okay, you have correctly pointed out so many things, but anybody from first year, second year? No? So we have few people today. It's okay. So you see, when we analyze the X-ray, and this is not just for passing exam, but it is also to give you a clue towards the diagnosis. So like you have completed your MS and now you are going to practice. And if a patient comes like this, so what is your opinion when you look at it? What is your opinion? Abhipray, what do you think this is diagnosis based on you have very rightly pointed out many findings in this X-ray. So what is your opinion? What are you dealing with?
So
Yes.
I like to put a GCT as like
Okay. Number one, you are saying GCT, fine. Is it osteochondroma?
uh,
I'm
uh,
just I'm just trying to confuse you. I can say anything. Don't think.
so I will not go for osteochondroma, sir. I'll still put GCT as first. I would put I'd definitely like to put Ewing's as one of the diagnoses, but sir, looking at the lesion and the radiological features, I'm like
Good, good. Nice attempt. Anybody else? Neha, you want to read this X-ray? Take a call.
Yes, sir. Good evening.
Good evening.
This is a plain X-ray showing mature skeleton. There is a there is a bony lesion extending from the metaphyseal and up to the diaphyseal region. Then I think there is intra-articular extension also, uh, and uh, uh, there is periosteal reaction. And it is like
Where do you see peripheral reaction?
sir distally, sir, if yeah, right, exactly at that point. And
Okay.
then again uh, uh, light